One. Hi, this is Deanna Kosaraju, founder of Global Tech Women, and I would like to again welcome you to the 2017 Voices Conference hosted by Global Tech Women. We're a network of women in technology around the world. And we started Voices back in 2012 because we wanted women, no matter where they are in the world, to have access to inspiring role models, to information, resources, and most importantly, community, so that we can share ideas with one another and how we are making a difference in the world. So Voices is a very important part of that discussion. And I would like to wish everyone out there a very happy International Women's Day. This is a very important day for all of us, and we celebrate all with you, as well as acknowledge and say we are in solidarity with the women who are participating in the Day Without Women event. That's happening here in the United States and different parts of the world. Me and many of my colleagues have been wearing red today in our support with you, and we stand with you. And I'm hoping that those of you who are participating in that strike will sit in on some of these sessions with us today as women in technology. So with that, I want to introduce our next session. So the next session is it had a little bit of a change, which you may have noticed. It's called the Internet of Things, Diabetes and Health Tech, What Consumers Want, Wearable or Med Dogs. And we'll understand what the Med Dogs thing is in a minute or two. The speaker is Jessica Ching. Jessica is a Strategic Marketing VP and Principal at Gateway mHealth and Strategic Marketing Advisor of ACTIONspot. So I was able to get a brief tour virtually of ACTIONspot, which is in San Jose. If you're in that neighborhood, I strongly recommend you go find them. They're over by the Amtrak station there in San Jose. It looks really cool. I'm going to go check them out. So with that, I'm going to hand it over to Jessica. If you have any questions or would like to make any comments as well as network with one another, we do have a chat window, and please feel free to utilize that. I will be monitoring that chat window for any questions, as well as if you have any issues at all, please don't hesitate to ping me. And with that, I turn it over to Jessica.
Hi, everyone. Thank you so much for being with me this afternoon, or whatever time of the world it is in your neighborhood. But I'm here to tell you, I'm really excited today to tell you about an incredible trend which is gaining momentum. And it starts with innovation started by health consumers. If you haven't heard that term, it is actually everyday people, me and you and everyone else. And like many consumer groups, we have a lot of power. It is a type of power somewhat like akin to women that has not really realized its full potential yet. But there is tremendous power to invoke this groundswell of action. And really tapping into the consumer side of the model is the key, in my opinion, to health. So I hope at the end of this talk, you will think about this in a new way. And that is how to make what you do, what you say, and what you use every day as a product into a health consumer product. So I'm going to talk about, these are the topics we're going to be covering today: the state of health, a little bit about diabetes, which is a very interesting model, about some opportunities, and then some really cool health consumer solutions. And I've given you a little bit of an insight to what's to come with both devices and dogs. So let's start out by talking about our state's state of health. By looking at this, we'll see why there is such a vacuum, which we all know. We all know that we have a very broken and many times inefficient and ineffective system, but how consumers can actually fill that vacuum. So when we talk about customer focus in healthcare, all of us in business know that the most important person in our business is the customer. And if you are in the healthcare industry, or even if you're not, because then you'd be someone who uses those services, the question would be, where is the focus? And that's an interesting question because there really isn't one. Healthcare is the only industry in the United States without a customer. It's a complex, confusing, and convoluted maze to manage, and many don't succeed. No wonder there's no customer or customer focus. and hence the problem. So, when you talk about who should be the customer in healthcare, you talk about, well, there are drug companies and medical device manufacturers making equipment. Who are the customers that they serve? And the answer to that is basically doctors. So then we ask the doctors and the providers, who is their customer? And their customer really are the insurance companies that pay them. So when we ask the insurance companies, who is their customer, then the answer really is, well, the government or employers who pay for the plans. And all of this is really pointed in that you and I are not part of this value chain. This is why there's no customer in healthcare. And this is part of the root of what I'm proposing today to talk about. So we had said that healthcare is a system that's broken. It doesn't work very well. You may have seen some of these statistics. These are very broad national studies done a number of years ago, but it takes on average around 21 days to get an appointment. And of people surveyed, 3 or 4 have difficulty either making an appointment or getting after hours care without visiting an emergency room. And even once they do get to the doctor, barely over half the people said that the doctor either listened, explained, or spent enough time with them that they felt that they needed to get that care. So this is a product that isn't working. This is the existing system that we have. This is the system that we've lived with really since the 1940s, since the quote, the time of modern healthcare. That's where we are today. Not only that, when we look at studies of outcomes of studies, we look at the quality of what we receive. So of adults receiving recommended care, again, a little over half receive the recommended either screening, diagnosis, or treatment that's been recommended. We don't have a lot of ways to get services for care other than using the system that we have. And it's no wonder that many of us don't have access to the optimal care that we want. If we looked at any other industry, we would flat out call this an absolute failure. So what does that bring us to? Well, what I say is that we have a need for complete and total disruption. So on the left of this picture, you can see this is the current system that we have, where the people like you and I are on the bottom. We're basically the people who receive the services. But really the people at the top who control the action are the providers, the doctors, the nurses, the lab techs, etc., the payers, the insurance networks, and the hospital. And this is really where the decisions are made and really where a lot of the resources are pointed. Really, for this to change, like every other industry, the people and the customers need to be at the top. And the providers of any services or goods that are to be delivered need to come from the needs of those people. So I call this the inversion of the pyramid. And it's something that, although it's very obvious, this is a key transition, because on the left, you really have a person who's called a patient, and hence their position of under power. When you move to the right side and you move it into a consumer health model, that person obviously becomes a full-on consumer with all the rights and privileges, and really they are the people that all the manufacturers and service providers want to make happy. So rather than talking about compliance, and which is really a very subservient sort of term of a patient, we are now talking about adoption or willingness to buy or want to use a product. And this happens in every other industry except health. If you think of the worst industries around, healthcare, spas, used car lots, you are still a customer when you walk in, and there's no pretense about that. But it is within the healthcare system that this is not true. So this is the disruptive innovation that needs to occur. So let's talk a little bit about the diabetes model, because although you probably are very familiar about the diabetes epidemic, at least in the United States, it is a very interesting model of one state of disease that has really started to invoke a consumer model just by necessity. So I'll just start with a quick slide for those of you that need a brush up on what is diabetes. It's a condition where the body can't produce enough insulin or cannot produce insulin at all, and it results in abnormal blood sugars. It's common. There are 2 types of diabetes, a about 1 million plus of type 1, which are considered uncurable. These are people whose bodies don't make any insulin at all. But in the United States, there are almost 30 million people with type 2 diabetes, which is an impairment of either the body's ability to make insulin or to use it. And they both result in the same basic problem, which is abnormal blood sugars, generally blood sugars that are too high. But when you think about this, that's 30 million people, and we are all consumers. And 30 million people can have a tremendous amount of power and influence. So this is definitely a place where disruption is needed and can take place. So the reason I wrote this here is this, this balancing of diabetes is very much exactly that. Every person with diabetes needs to balance insulin with all the other things on the other side of the scale: their food, their stress, their sleep, and exercise. It's a constant balancing act. And because of this, it's ripe for innovation, simply because it's nearly impossible to do this inside of a doctor's office. It has to be done at places where we all live and work and breathe and play every day. So just some examples of diabetes by the numbers. By the way, I've had type 1 diabetes since I was a kid. And interesting to note, I check my blood sugar at least once every 2 waking hours. So with a continuous monitor, I check over 100,000 times a year. In taking, on average, 6 doses a year, I've taken over 83,000 doses in 38 years. The American Diabetes Association recommends a target of 150 average blood sugar level. My target is 120 with 10% above range and 10% below range and less than 20% above range. And when you talk about all of the statistics around all the supplies that have to go into the management of this, it's an untold amount of closet space and as well an untold amount of medical waste. And the reason I bring this up and why does this matter to us as consumers is you can see by all of these numbers and this constant need to monitor health that there's a lot of opportunity to measure and monitor better, to make your life easier, seamless, more automated, many, many instances. And there's a ton of opportunity for innovation. So again, these are all things that they may be created in a company, but they will all be used almost exclusively outside of institutions, in the homes and workplaces and communities, in the gym, the grocery store, and all the places that we live every day. So I wanted to put this picture up of myself. This is me. This is me at home or another place that I like to be, out on a hike. And it is health 100% by the consumer, and that's me. And the result that you can see here is pretty outstanding. I mean, I was able to hike up to this wonderful spot on a mountain, take in the view. You can see there's a little pink thing around my waist, and that actually is a medical device that I carry with me. But a couple of things. One is that it's pretty small, and the second thing is the color that I chose. So this just sort of speaks to some of the choices that we have as consumers and that we can push forward. So then I wanted to talk about the opportunity as well as a health consumer. So as I've alluded to, health is everywhere. You know, when we think of health, we think of a doctor's office, we think of a nurse, we think of a laboratory, we think of a hospital, we think of a clinic. But virtually, the vast majority of your time, even if you are someone who is ill, is spent outside the hospital. Even though you might spend time in the hospital, the goal is to get you better and to get you back out into the world. And the rest of the time that you spend there is the time that you spend taking care of yourself. And this is a major reason why diabetes, as well as other diseases and health, is ripe for innovation, is that our health never happens in a hospital. In fact, most of us don't associate hospitals with health and wellness. We associate them with sickness, which is generally true. But another key thing is, if you see in the community, I've got this picture of all these people there, but on the right side, I have just a few people pictured with the hospital and the ambulance. And what that symbolizes is the people who control each of those environments. When you are in your home and work environment, you are the person, you and the people around you are people in control. When you're in a hospital or in any kind of medical institution, sorry, that someone just poked their head. In a hospital or medical institution, it's really the doctors, the nurses, the technicians, the x-ray people, everyone else controls the environment. And really the goal for all of us, I think we all know, is to take control and power of our own health without any gatekeepers. And that's the problem here. You know, as a person with a chronic health condition, it's interesting. I have not been to a doctor in 10 years for consultation on my condition because I actually manage it mainly at home. There's a few times when I have a televisit or, you know, a phone call for something that I need. But for the vast majority of years, 20, 30, almost 40 years, I have managed blood sugar and essentially all of my health through the devices and other tools that I'll be talking about without any influence from the institutions that we sometimes dread and don't want to go to. So the solution is not that to improve health, is not that we have more doctors. You might have heard many people say that there's going to be a great shortage of doctors in the United States, but that's the system that we use today, where we have to go into a medical institution. So I would profess that we have actually a great abundance of doctors if we used this model. And we would also have a great abundance of hospitals rather than a shortage of hospitals and beds. And it's not that we need free care, it's that we need better care that's more accessible and available to the person who is a consumer. So this brings us to the next slide, which is another really interesting point about consumer tools for health. When we think about health and medical tools, what do you think of? You might have thought about a Fitbit, which is a great tool for you to be able to track things, but many times tools are emergency care solutions, clinician assistant solutions, laboratory tools, hospital tools, radiological or imaging tools, diagnostic tools, nursing support tools, medical record tools, physician tools, tools that help those people who already hold way too much of a concentration of the power for health empowerment. So I would say that while I often read that people are criticized for not taking care of themselves, I would like to put this out, that I think that every single health tool that becomes available to a consumer becomes a great tool for them. And if you look today about where the health tools that are needed are, they are greatly and overwhelmingly needed in the consumer space. So it's not a tool that to help a doctor or a clinician help their job better. It's a solution to help a consumer do their job better, something that a consumer wants. So this is another point about things that consumers want. Not only tools, but access to their own metrics. People own their health when they own their data. When you think about this today, on the right side, this is how you get a metric about yourself today. You go to your general doctor, who then sends you to a specialist doctor. So you make another appointment, you drive to another institution, you find parking in a parking lot, you go to that doctor. The doctor looks at you and orders a lab report. So then you go and get in your car again or get into public transportation, you go to the lab and you have a sample drawn. The results are then sent back to your doctor, not to you. A very interesting point. And then the information is usually, but not always, conveyed back to you. And that today is the very long chain that it takes for a consumer to find out about their health. In a direct-to-consumer model, which you're very familiar with, especially with internet purchasing today, this is when a consumer actually samples themselves, pops it in the mail, and sends that in. And there are a few cases where, like in blood test meters, where a consumer can actually draw their own blood and receive a reading right there at home. I will tell you that it is very, very efficient and convenient to do that as someone who does that tens of thousands of times a year. But this is one of the fundamental changes that I think is needed and that we as consumers can demand, and that is access to our own, not only our metrics, but the ability to measure ourselves. So while today there are legal prohibitions against us getting receiving our own testing, even our own genetic results, I would say that the real change that can happen in healthcare is to turn this model the other way around. And this really brings me to a point about a spectrum of healthcare. If you think about healthcare as, let's say, a 10-point spectrum, with 0 being prevention and 10 being the absolute worst just before death when you're rehospitalized. I used to be someone who thought that I, as a consumer, really could only do step maybe 1 or 0, prevention or information access. And what I've realized is consumers have the power to go well into the spectrum, into doing their own diagnosis, monitoring, assessment, and even taking actions on those monitorings, which is something that 30 million people with diabetes actually can and often do today. So we already have a well-tested, proven model. And for some people, you can even go past the middle of the spectrum, and with access to your own readings and how your body is working, you can become aware of something that in the past that you could only find out by going into an institution or going to a clinician. We all know that isn't very convenient. And I think the biggest thing is that we are not treated as the individuals that we want to be treated as consumers. So technology has, of course, enabled a lot of this. We all know about the internet and mobile devices. Smartphone usage among Americans is very high and increasing, and so is social media usage. And while social media usage is sometimes looked down upon as maybe chatter or just entertainment, it is a very, very strong and powerful way for consumers to get information, both for them to find health information, for them to find specific information about a disease they may have or their families may have, and for them also to be connected to peer networks, which I'll talk about again a little bit further down. But I think one of the big changes that we have to do to make this leap from health or to health consumer from being a patient is to really change the language that we speak. Today, we're all very accustomed to being called a patient, to receiving point of care, to being told that we should be compliant and adopt, excuse me, that we should adhere to the orders that have been given us by a provider, that we should recognize diagnoses and prognoses and diseases, and that we should listen to the therapies and the interventions that have been prescribed to us. But I will tell you that for every other product, it's a different game. It is always the consumer and the person who's using and purchasing the product who is leading. And that product is created and built and serviced for that person to be used wherever they are, whether it's at home, on their sailboat, out on vacation, or wherever that is. You can never force a person to do what they don't want to do. So the key to success, like any other product, is getting willing adoption and getting that person to prefer your product or service over another one, which is something we never hear about in healthcare. And even down to talking about the events in and around the ecosystem of healthcare, talking about consumer surveys rather than clinical studies, talking about peer groups as opposed to support groups that you're dependent on, and talking about your state of health rather than talking about diseases are all ways to make health a consumer product. So now I've come to a really fun and interesting part of the discussion. So we've heard about some of the reasons why we should be a health consumer, some of the problems with the current system that we have, and some of the challenges. So I'd like to spend a little bit of time about talking about solutions and innovations. And consumers can, and they have influenced the outcome of these solutions. And you too can lobby for some of these. The first is to look at a purchase funnel for health products. So every time you go into a doctor's office, you go for a lab test, or you even go to buy or take a medication, do you feel that that product or service was developed for you as a consumer down a purchase funnel? So in the consumer products development industry, anytime we're going to develop a product, we start with awareness and familiarity. We look at what people want and how aware they are of a product or market and what their needs are. And then we look at how familiar are they with our brand. Then we look to drive a favorable opinion. Hopefully the person will try our product. Hopefully they'll keep using the product, and then they'll be convinced enough that they want to purchase the product and continue using it forever. So this is a classic model that's used for every single product and service on market in the country and in the world, except for healthcare in this country. So we have the opportunity to turn our health and medical products into consumer products that a consumer can use. And of course, to do this, that takes a lot of considerations, not just in the product itself, but how it's used, when and where it will be used, and what it will take for the person to want to use that health product. So here's an example, and it is, I would call this a traditional consumer product choice category, where we actually have these today, but that consumers have influenced the choices for monitoring and management of diabetes. So this is one industry where you see, for example, blood glucose meters in a rainbow of colors, any one that you may want. You might find a cordless monitoring system. You might find a medical device that's integrated to your phone, or even now that reads directly to your phone. You might see with the little finger icon, that is actually a sensor, a continuous glucose sensor. It's like a little eyelash wire that goes right under your skin, but it's pretty minimal in size. It's very, it is considered an invasive product, but it's what I would call a non-intrusive product, so that a person could wear that under their clothing undetected and without, announcing to the world that they have a medical device on. And these are all things that consumers have had a hand in influencing. So there's been a flurry of activity, at least in the diabetes industry, for some of these devices. But after decades of waiting, there are a number of devices coming to market. So much so that in many ways, healthcare providers and practitioners are having a hard time keeping up with what's new, what's becoming available, what's out there, what the choices are better for one brand to another. And this is another place that you as a health consumer can have a greater role. I know that I have gone to my doctor more than once with the primary reason not just to maybe seek that person's opinion or advice, but to help them see that the type of device or tool that I was using was something that could work for her patients as well. So very interesting. Some of the role reversal that we don't think about can definitely work. Some of the other devices that we think about are ones that are discovered by consumers themselves. These are all pictures of medical alert dogs. They are medical scent detection dogs, and they've all been trained to smell the smell that's imperceptible to humans of rising and falling blood sugar. And you can see on the black dog, kind of in the center of the screen, she's got a little blue tab by her neck. And that is the signal that she uses to alert her owners when she smells that glucose is either rising or falling. She'll actually put that in her mouth and bite it. It's a unique signal that was developed. But it's very interesting that it was actually a consumer, a regular person with diabetes. He's actually a friend of mine who founded this organization, who was training a seeing eye dog one day. And one night, in the middle of the night, the dog woke him up in a panic. It was 4 a.m. And he was very surprised that, I think the dog was 7 months old at the time. He was training the dog to be a seeing eye dog. He was very surprised that the dog would wake him up for an unknown reason. And interestingly, the dog didn't know why he was frantic either. The dog just knew something was wrong. Well, it turns out that some tests were done, and my friend realized, having diabetes, that his blood sugar was plummeting. And some tests were done, and it was confirmed that dogs can indeed smell the smell of blood sugar as it's falling, and sometimes before it happens, because they smell the chemical precursor to this happening. And this was discovered by a consumer, a person like you and I. amazingly. So when we think about medical devices, obviously dogs, there's a lot of considerations to having a medical service dog. It's a lot of work actually, but they provide a wonderful service. It's one of a great array of tools that a person with diabetes has available to them. But when we think about things that can help our health, our well-being, and in terms of medicine, they aren't always the traditional things that are somewhat unlikable that we might always think about. And so this is a great example of a medical device. So here is me with another dog. His name's Colton, and he's on a hike with me. And you can see in the red circle that he not only has his, it's called a bringsel, that's the little tab that he wears on his neck, but he's also signaling me with his paw. And you can see in the middle that he was also very focused on me as his way of telling me that he could tell that my blood sugar was changing. So it's a wonderful thing to have, and a wonderful consumer tool that has been brought to market. I would say certainly with the help of eventually some of the doctors that became involved in the project. But in the beginning, it was really a bunch of just people, consumers that were concerned about their health that began this effort. So, we talk about the people concerned about the effort and the people in our networks, the people in our inner circles that we love, that we cherish, that we spend time with, that we rely on for a lot of things, our lives, our family, but also our health. And I wanted to talk about the power of a network. So I think I mentioned earlier in my talk that consumers as part of a network and part of a peer group have a lot of power. And I mentioned that I hadn't been really going to a doctor very often in the last 10 years. And you might ask, well, is that a good idea for someone with diabetes not to be going to the doctor in 10 years? And I will say this varies a lot by individual, but I will say with certainty that the single thing that has allowed me to receive all the medical information that I need to receive and all the advice that I need to receive on how to manage my health has come from my peers. It's basically a great network of friends with diabetes. So today we have blogs, we have meetup groups, we have chat rooms. But even 10 and 15 years ago, we had regular old email. And even before that, we had phone trees. And this has been my number one go-to for health solutions for many, many years. And, I talked about the proliferation of some consumer health devices, at least in the diabetes area, that even clinicians are having a hard time keeping up with. And about 10 years ago when this started, I started to go out to my peer network to see if I could get quicker and more real life information from my own peers than I could get at the doctor's office. And very interestingly, what I found and kept finding was that I got great information from my peers. And in fact, it was even better than what I could get from a nurse, a doctor, or a laboratory person. So over time, I've invested actually a tremendous amount of time and effort into building a number of networks for lots of different things. Some people are very scientific, and I go there for laboratory pattern analysis. Or in diabetes, we have a lot of data. We collect tens or hundreds of thousands of points of data that we have to sift through and sort through every day, week, and month, and it can be overwhelming. But I have a group that we actually will look at those patterns together. And because we know each other's personalities, I actually find it more effective than having a doctor who might only see me 2 or 3 times a year review those patterns. I know you may be sitting there saying, this is crazy. You're saying that I can really be the person in charge of my health and I can use my friends. And I would like to say that I'm not promoting that you do that, but rather I'm saying that this is an option available to you that you can leverage if you choose to do this for your health. It's greatly empowering, and I will tell you that it's been an incredible journey for me personally. So when I think about, the chain of innovation and time to market, some of the innovations that I talk about in medical devices, it takes a company a tremendous amount of talent and resources and money and time and effort to develop them and bring them to market. On average, it takes about 12 years to bring a drug to market. And on average, it takes 3 to 7 years to bring a medical device to market. And that's a long time. And that's for each version of the drug or device. But think about this. Have you heard of the term citizen science? You got a little bit of a clue of that when I told you how the discovery of medical diabetes alert dogs were discovered. It was actually through citizen science. And we, as consumers, are in great need of tools. And in fact, we have a ton of leverage. So I wanted to close the last slide and talk about some of perhaps the most out there things that I've been doing as a citizen scientist and a health consumer, and that is this grassroots movement toward citizen science innovation. So I'll take the industry of diabetes, which is very well established and we all know about. And of course, we do have traditional means, doctors and nurses and laboratories and hopefully not hospitals, but if you do need them, there are there for you. But there were a dedicated group of consumers that started a few organizations. One of them is called Night Scout. So you can imagine being a parent of a child with diabetes, and this child takes 8 shots a day and gets their blood tested 12 times a day. Well, who does that when a child is sleeping for 8 hours? And the answer is that parents oftentimes will take shifts in doing this, which means that not only does a parent never get more than a couple of hours of sleep, but that they're always worrying. So it was a few parents as well as a few people who were engineers and computer programmers and developers and really hackers as their day job created an organization called Night Scout to put their information from their blood glucose meters into the cloud and be able to bring them back down on the device like you see here with an actual live reading of my blood glucose. You can see as well in the picture there, and took up the hashtag "We Are Not Waiting." So I'd mentioned that it takes 12 years to bring a drug to market, and more relevantly for us, 3 to 7 years to bring a medical device to market. And this was built in the space of, I don't know how many months, but it is available to an open source community today. That was the first step in going toward something that I'm now participating in actually creating an open sourced citizen science derived artificial pancreas. And I wanted to show this to you because I am actually wearing this today. I don't know if you can see it in this light. So this is the dashboard that I use to monitor all of my blood sugar. I do use a commercially available insulin pump and a commercially available glucose monitor. But the software to hook it together and the gateway, there's another third piece of a device that was created to do this, came from a movement called Open APS that was started by essentially 2 computer programmers, one who had diabetes and the other who had this great quest to help his girlfriend manage her health in her everyday life better. And they started this movement. It's now evolved into something called Loop, when you see that little green circle, and that is actually the device that I'm running. So I mention this because the power that when you think that consumers and citizens have in science and your health is absolutely and completely limitless. It ends only where you will allow that to end, and it can take you to many different places. So we've gone all the way full circle from the problems with health and diabetes all the way to here now to where we can go. And so we've got about 20 minutes left in the talk, and I hope that I've provoked some of you to thinking about new things that have never crossed your mind before, or if they have, of you to take action. and I'd love to answer any questions that you may have.
Thank you, Jessica. Can you hear me?
Yes, I can.
Okay, I had a bad headset earlier, so I'm just making sure people can still hear me. So what an amazing presentation. I'd like to open this up for questions. If anyone has any question, feel free to put yourself on video or take yourself off mute to ask the question through audio, as well as you can ask your question in the chat window here, and then we can provide an answer for you. So does anyone have any questions? While they're doing that, they're taking themselves off mute and figuring out where the buttons are. I wanted to ask you a couple of questions. So the first one is, let's say that you have an idea for something, you have asthma or you have some other chronic disease, and you have an idea on how you can leverage technology to accomplish that. What would you say the first steps are? How would you recommend people, what's the trajectory people should go?
So there are lots of skills and talents that are needed to bring a product to market, whether that be a drug or what's probably most appropriate for our case is a medical device or any kind of consumer device. And eventually you will need a team of engineers, industrial designers, and scientists. But I will say that the opportunity for us is to make sure that the needs that you feel as a consumer are embedded in the solution that that device represents. And one of the best ways to do that is to either join or start a group of people that have the same needs and desires that you have in this creation, this idea that you have. There is a lot of power in numbers. I will say diabetes is another industry of note because it has been influenced tremendously by the consumers that use its products. As you can see, they are products that are carried and used by people every minute of the day. So people have a lot of opinions, just like, your cell phone, because this is something you carry and use every minute of the day. Every cell phone manufacturer wants to hear from you so they can make their product better, so they can be more competitive. And interestingly enough, in the diabetes industry, this has happened to a degree because of the voices of consumers. So there's a number of ways, Deanna, I think to answer your question directly, that can be started. But one of the ways that's very powerful, even if you are not a physician or someone with a healthcare background, or you're not a scientist, or you're not an engineer, you are still a health consumer. And your voice as a consumer matters. I think it's pretty standard practice these days for all of the diabetes industry to monitor and look at the blogs that are out there that consumers are either rejoicing in or bitching about something. Mm-hmm. And it is definitely a very powerful way for a health consumer to have their voice heard. So I would say that would be the first step of if you're interested in bringing a product to market. And then I think probably the next step is to join forces with some kind of an industry conference or seminar or panel and get the word of that idea out to a broader group who you can partner up with potentially and potentially become an advisor for. Mm-hmm. Mm-hmm. All things that are definitely happening today in some industries like diabetes. I think it's pretty routine to have customer panels of all sorts, from everything from the user interface to the actual poking of the finger to the parents groups and even the allied ecosystem around it, the ways that consumers prefer to buy. Mm-hmm. Do they want to buy from the pharmacy? Do they want to buy from mail order? Who do they like to get their advice from? So these are all things that health consumers have helped influence, not just in the product, the way they buy it and how they go about getting reimbursement even for it has been influenced. And even the reimbursement decisions to get, in many cases, insurance coverage.
I think diabetes is, the people who have been working on diabetes have made tremendous progress. And I see a lot of other health issues that haven't made as much progress. So perhaps even looking at the way people have approached diabetes in terms of consumer advocacy and consumer, like you were talking about this example of this woman who, realized that her dog was, figuring out her blood sugar. What are some of the ways that we can learn from this particular group of individuals and citizen scientists to come up with methods for some of the other issues that probably haven't had as much effort done from the medical community, because number one, it's not as profitable, or number two, they just aren't willing to focus on it because they're focusing on things that will make them more money.
Yeah. So, your voice again as a consumer, I mentioned that there is a tremendous and terrible shortage of devices that tell us our state of health. Really today, there are a couple of things that you can buy a pregnancy test. Even I saw it at the 99-cent store at Christmas. And
I don't know if I would trust that one.
Because they've made that test so accurate and so inexpensive that it's prevalent everywhere. But just imagine if every metric about us were 99 cents and a drive away from the drugstore away. So today you can get a number of tests online. You can get sampling containers and you can do those things at home. But we are in great need of tools. Consumers have basically a Fitbit, a scale, and a thermometer. Not much else. It's not much else that we've had since the 1940s, if you think about it. And when you think about, health and technology, we think of all this equipment that's in institutions and basements of hospitals, things that cost hundreds of thousands and millions of dollars, but are accessible to so few people who know their own body. It's really partly up to us consumers to say, this is what we want. So, your example of someone with asthma who wants a device to know when their lungs are clearer, or if their headaches are contributing to this, or if the changes in their heart rate are tied to their asthma, or if their medications work better on a certain type of condition or with certain types of food. One of the things is science comes from observation. I do a lot of the grassroots science myself by just observing what I see and hear and feel about myself, and I try and document that. And to any degree that I can, I try and take the tools that I have and use those and get those metrics. So that can be a good starting point for doing these things.
So is there anybody else who has a question? I see, Jerry, you've taken yourself off mute.
Yes, I was very curious. I'm also diabetic type 2, not type 1. And I have a dog who is staring at me right now, who has been barking through this entire call. So I feel like, thank God for mute, and who's now heading this way. But I was wondering if, is there a special kind of dog that can be trained to be a glucose level detector, or could any dog be trained to do that?
Well, I can speak mainly from the organization that I train with, and I'm a volunteer for it. It's called Dogs for Diabetics, which was founded by this gentleman whose guide dog for the blind that he was training for a seeing eye dog alerted him one night. The dogs that we use all come from a guide dogs for the blind, heritage and background, and they're bred and raised for that purpose. They typically are disqualified from being a seeing eye dog for some reason. Maybe they really can't seem to get over the hang of getting riled up when they see a cat, for example. So that would disqualify them from being a seeing eye dog. But what we found is that we can oftentimes retrain them with all of that baseline training that they receive as a seeing eye dog, and train them to become a medical scent detection dog. They get certified by Assistance Dog International, and it is a pretty rigorous standard because they have to pass all the public behavior tests. And of course, when they are assigned to our clients with diabetes, we want to make sure that they have a minimum level of accuracy and that they're going to sustain that. So all in all, the dog receives training for about 2 years, 24/7. That's starting with they're 8 weeks old. Yeah. So that's the dogs that we have. They typically tend to be the breeds that Guide Dogs for the Blind uses, which is Labrador Retrievers. And the reason is labs have 3 qualities that are good for diabetes dogs. Number one, they're smart. Number two, they have a good nose. And number three, which is usually the characteristic that disqualifies most dogs, is they're willing and very desiring to work. So labs are sort of bred to be work dogs, so we find them to generally be very good at that. You know, it is, you don't think they're working, but they're constantly smelling, and dogs will come running from across the yard because they smelled you sitting on the porch, and their nose is actually always working. It's very interesting. I have a whole nother talk on that.
That's very cool.
Yeah, it is.
Yeah. Okay. And then the other question I had is, have you heard about these new devices that are being developed to enable doctors to embed devices with islet cells under the skin so that they can produce insulin naturally?
Yes, they're called islet cell transplants. So for those of you that are not aware, the islet cell is actually one of the cells inside of your organ called the pancreas. And it is that cell that creates insulin for your body to function. You don't realize this, but your body needs a few things at all times, at least your brain does, to continuously function. One of those things is oxygen, and the other thing is blood sugar. So it is a really critical function that the body receive a continuous supply of that. The islet cells that are being transplanted are done, and I just heard recently that the success rate is increasing to the point where I think at least half of the transfusions last 5 years. It used to be that only 30% lasted more than 2 years, but I think in the last number of years it's been increasing. It is a transplant though, so like anything that's implanted in your body, whether it be a whole organ or even just a transfusion of cells, you have immune tolerance issues.
Mm-hmm.
And basically for the rest of your life you do need to take immune tolerance drugs, which then, yes, it's a smaller and perhaps less lethal cocktail because the physical amount of cellular matter in your body is less. Mm-hmm. But there are downsides for the person to consider. So I don't think that's considered a first line of treatment in any way, shape, or form.
Okay, great.
Yeah.
Thank you.
Uh-huh.
All right. Well, unless anyone else has any questions, I guess we'll wrap up.
Okay. Thank you, everybody. Thanks for your time.
Thank you, Jessica. Really appreciate it. Great talk. And
thank you, Deanna.
Our next sessions, believe it or not, will be at 4:30 in the morning, where we're going to be doing a number of sessions from India. So I expect you all to be on those with me. So anyway, if you can't make those, there's a number of really great sessions that are happening on Friday as well, that are really focused on well-being, personal development, some really great sessions. So I encourage you all to jump on our website, globaltechwomen.com, check them out. You can set calendar reminders, and I hope to see you on one of those sessions.
Thanks again, Deanna. It's a great program.
Thank you, Jessica. Good luck tonight on your talk.
Take care.
Okay, bye-bye. Great.